After days of testing for President Biden at the White House for COVID-19, many are wondering how many days we might be stuck at home if we get infected with COVID-19.
Medical reporter Liz Bonis looks at what the CDC is now recommending.
Hey there, hello to you. As more of us get the coronavirus, sometimes for a second and third time now in this pandemic, the question continues to come up: how long will it be before I test negative?
According to the CDC, perhaps longer than the standard 5 to 7 days we previously were told would put us in the clear for COVID-19.
And honestly, in a test, you can be collecting not only active virus, but dead virus, ineffective virus for many days after.
Dr. Franz of the Cedarville University pharmacy team says what you need to know about this, however, is generally if you no longer have symptoms, you likely aren't contagious or at risk of spreading the virus to others.
I know a lot of employers were looking for a negative test before coming back to work, maybe after a 5 or 7 day window, and that's really causing some problems.
The CDC did recently find in this study that more than half of us who took a rapid antigen test after as much as 9 days were still positive for the virus. It's one of the reasons they continue to shorten the isolation window after infection. It's now down to 5 days if you have no symptoms, or if your symptoms are getting better and you haven't had a fever for 24 hours. You should still follow that up, however, with 5 days of wearing a mask around others to lower the risk you could pass it along.
Now, there is some evidence that Omicron's BA4 and 5 are starting to plateau, but that BA 4.6 is still climbing, and this testing then may be critical for early treatment, as there is some evidence that that variant may lead to more severe illness. I'm medical reporter Liz Bonis.